All right, I stand between you and your lunch, so I better go fast. Good afternoon, and I really want to thank UNESCO and Merck for inviting me to this summit. Being the first one, I can always say, you know, I was there when it began, right? It's a pleasure for me to talk to you this afternoon about the strengthening the capacity for health research in Africa. I think it is very appropriate for me to approach this topic from a very personal standpoint. As many of you know, the drive to strengthen capacity for health research in Africa gained prominence in the early 90s. It was just about the time when I began my research career. For me, it has been an extraordinary journey, being one of the few African scientists when it began, and as someone still involved in the continuous strive to build capacity for health research. I've had an unusual experience, and I'd really like to share some of this with you. Now, I will have structured this presentation to 3 parts: my personal experience with this strengthening initiatives, challenges then in strengthening the capacity for health research, and some new health research initiatives that are coming out. What I hope you will take from this is that strengthening the capacity for health research in Africa should be viewed as a continuous process. It's not a one-stop, let's fix it, and much help is needed to keep the process moving on. We all know the statistics. The African region is threatened with the world's most dramatic public health crisis, be it infectious diseases, non-communicable diseases, preventable diseases, or emerging infections. The burden is there, and the population is at risk. One of the ways the global community is responding to the health crisis in Africa is by investing in health research, especially through strengthening capacity for health research in Africa. The hope is that by doing this, getting research institutions, scientists trained locally and out of Africa, having a critical mass who can conduct research to develop solutions or products that will address the burden of health issues that affect the African population. So the recurring question always is, what is the best approach to train the scientists and health professionals in Africa to produce scientific knowledge and tools to address diseases affecting the African population? We've heard all about it this morning. In the last 5 decades anyway, many scientists and institutions have conceived and implemented several initiatives as an attempt to address this question. Please, you'll bear with me a little bit. I'll talk only about 3 of these initiatives. We don't even have much time that I've been directly involved in. Number 1 is when the Department of Biology in Georgetown University, Department of Medicine in Hawaii, and myself at the University of Yaoundé 1, we've had an ongoing collaborative project. It's a partnership on malaria in pregnant women and newborns. And in this partnership then, we have continuously, it has been funded by USAID, NIAID, NIH, and Fogarty. And we had in this partnership, we had 2 main goals: to conduct research on malaria and to train and raise a critical mass of scientists to continue research at the Biotechnology Center of the University of Yaoundé 1. Yes, we thought we had it, we figured it all out. So where are we 25 years down the road? We conducted research and trained many students at the MSc, the MD, PhD levels. It looked like our plan was working very well. Where are we now? The majority of these scientists are based in northern institutions, and the few that are in country are completely absorbed by their teaching commitments at the university and with positions, administrative positions. This leaves us with a dilemma then. I know this morning we heard about it being a brain gain, which is good. But where now is the critical mass of scientists to continue research at the Biotechnology Center? We asked that question, but we still continue then to train. Now, That's the one I had to be talking about. Next one. The next one is the MIM-TDR program. This program was initiated in 1997 by a group of agencies and governments. It was led by Harold Vermoos, a Nobel Prize winner, and then he was the director of the NIH. And he wanted to promote capacity building then in Africa in the context of malaria research. The program awarded grants to early and mid-career African scientists working in research groups in Africa. Many of the prominent malaria scientists we now have in Africa today were supported by this program. Hence, this program supported them at the early stages of their career and helped to train them to become independent researchers. Unfortunately, the last round of this MIM-TDR grants was awarded in 2009. We at the MIM are still looking for funding to revive it. So, where are the research capacity building programs to support these early and mid-career African scientists? True, as we've been hearing, there is some optimism now, as it seems everyone is so conscious and of this gap that is existing. Case number 3, the EDCTP program was launched in 2003. Many of you must know about this, with the overriding mission to build clinical research capacity in Africa. Among the several very good things that this program did was investing in research infrastructures. It equipped research laboratories in Africa and had some very functional networks in the region. Research funds provided through the EDCTP program helped to sustain these research laboratories. Unfortunately, with the expiration of the ED program 1, most of these labs and research groups are dormant as they wait for the next program. So the problem is that funding is sparse and far in between. There is no pipeline of funding to sustain research activities. How then can research groups or laboratories in Africa sustain their research activities when funding from a donor phases out? So these challenges raised really are not unique to these initiatives or programs, but they are highlighting some of the difficulties in strengthening health research capacity in Africa. All these programs had genuine and good intentions. They probably realized all their primary objectives, but the challenges in strengthening research capacity still persist. As we've gathered here to discuss on the transformation of Africa into a hub for research excellence, we need to think thoroughly on how we intend to go about this. Now, the challenges cited so far actually a snippet of the reality. Allow me then to extensively outline more challenges for the time that I have and how they're hindering research excellence in Africa. Some of these are interrelated. Addressing one or two might really help us, and many of them have been spoken about today, so I really don't mind going into much details about them. But the few that I have, number one, there is little or no alignment between research strengthening efforts and national development agendas. Research is really not a priority in many African countries. Research budgets are in the lowest. There is this declaration about a 2% health budget for research. We heard about 1% this morning. Most health research strengthening efforts are funded by international organizations. These organizations have their own agenda and priorities. Often these priorities do not align with the research agenda of some of the countries. Capacity strengthening efforts, they need to consult with national governments so that research capacity development work can be harmonized with the development of broader national health research systems and innovation systems. Governments will be reticent, maybe, and difficult to dialogue with sometimes. But if we want these initiatives to have the greatest impact, we need to get national governments involved in this way. It will be much easier then for researchers to ask questions and design studies that resonate with national policy and developmental agendas. We heard a lot about Uganda. It might be the exception with South Africa. But Africa has 46 countries, and this applies to those ones. Number two here, There are very few research leaders and few or no solutions to local health problems. Now, we heard a lot about the Ebola crisis, and besides the numerous things that have been revealed, I think two things really stand out for me: the absence of adequate scientific solutions to deal with local health issues, and the absence of leadership, including then research leadership. The crisis we've heard about uncovered the frailties of research capacity building efforts. There are still no solutions to many of our local health problems, and even when these solutions exist, access is difficult, implementation is difficult. Most often, research capacity efforts focus on the big three health issues we've heard: HIV, malaria, and tuberculosis, leaving other disease burdens such as neglected diseases and non-communicable diseases unattended. Just recently, we know about what happened in Niger with the meningococcal disease occurring in Niger with about 8,500 suspected cases and so many deaths. Research strengthening efforts therefore need to encompass all these health burdens and be suited to respond to health issues. Number three, there is the extremely slow uptake of research results or findings into policy and practice. Most often, research findings or solutions that can have immediate impact on patients' health do not easily get into practice. We generally rely on disseminating the findings in peer-reviewed publications, hoping they will be picked up by policymakers and then be put into practice. We heard this morning the minister talked about chloroquine resistance. We know there were ACTs. How long did it take for us to get to that? We have rapid diagnostic tests for malaria. It's been shown to be very effective. Implementation for this has been very, very slow. We know about the efficacy of sulfadoxine pyrimethamine for IPTP for pregnant women. You look at the coverage in countries, it's just about 20%. And we know that if this were done, you know what kind of results we will get. The reasons then for this slow uptake could be multifactorial, but we need to make sure products and solutions that have been scientifically proven be useful should easily get into practice. Then this leads me to the fourth point: limited support for conducting and communicating research findings. Publish or perish, that is a scientific mantra, and we work very hard towards that. The findings we obtain from our research activities are good to be shared with colleagues via peer-reviewed journals, as we said, scientific conferences. Rarely do we bother about our local clinicians or policymakers. Fortunately, this is an aspect most health research capacity strengthening programs are trying to address. Most programs request dissemination of results locally and strong interaction with public health officials. So we hope this situation will get better. Number five is too much focus then on knowledge generation. So much of the research conducted in Africa and by African scientists is on knowledge generation. For example, we talk, the prevalence of this and resistance and so on. We generate knowledge, but what is the impact? In many instances also, we are data collectors. We need to be idea generators and come up with our own research agenda that is supported by our governments. African governments should fund research with substantial amounts. I don't know how we can get this to happen. We need to go beyond this culture of knowledge generation and cultivate a culture of innovation. Innovation not only in the development of drugs or vaccines, but also in designing strategies to finance, to engage, and to deliver health interventions to communities. Innovation is not just about new, but also in doing things differently in a more sustainable and effective manner. And the next, is it here? I'm sorry, I'm not going with my slides, am I? No, this is it. On completing this lack of research career opportunities, on completing a PhD, most African researchers are faced with two options: Either they move to a northern institution or are recruited at a local university with primary function to teach. Truly, there are few or no sustainable research career opportunities for young researchers once they complete their PhDs. If we want these young scientists to become the research leaders Africa needs, we have to invest in them, invest in viable research institutions. We need to find a way to retain them after their PhD at our local institutions and provide them with funding opportunities, intensive mentored research experience. Also, an enabling environment. Our environment barely encourages or rewards those involved in research. There are few research institutes which often are poorly equipped. Even at the universities where research should be promoted, the infrastructure is lacking. Even when the facilities may exist, obtaining reagents, as you know, would be extremely difficult. Supporting mechanisms or mentoring plans to groom young researchers for those who are involved in research is needed. For those who are involved in research, there are little or no awards and recognition to help motivate researchers for their achievements. Now, talking of mentoring, we just responded to a call from TDR to help young women scientists to develop their career plans. And in this, we've really been able to establish a strong mentor-protege program. And I know this is really important in for most research scientists. There's also uneven geographic coverage of existing and future research capacity strengthening programs. This picture that I have here, I really love sharing it. I talked about it this morning a little bit with Nadia. At present, geographic coverage of research capacity building activities is very uneven, as you can see there. This is just for HIV/AIDS, but it's not very different with others. I wrote about this paper in the Lancet on this. There is so much focus on Western, Eastern, and Southern Africa, and practically little or nothing outside Anglophone Africa and Central Africa. Please allow me to I will conclude by praising the efforts of two new initiatives that have been launched, though it may be quite early to uphold these initiatives in such high esteem. I do firmly believe that these initiatives are coming out to address some of these challenges and in transforming Africa into a hub of research excellence and innovation. I will be especially glad if support can be mobilized to help these initiatives. The first one here is the RF. This program is meant to support early career African researchers. What I really like about it is the mentoring and nurturing experience that these early career scientists will benefit from. I hope our young scientists apply to this program. Obviously, they would be retained for the program if funding is available to support. Without any conflict of interest, please support this program in whatever way you can. The second initiative is the Alliance for Accelerating Excellence in Science in Africa, IASA. And I know that Kevin Mash will be here to talk about this, which has, it's NEPAD, it has the Deltas program, the Grand Challenges for Africa, and engages innovations in Africa to solve the most pressing challenges in global health and development. This is Kevin's talk, and he will be here to tell you about it. Well, now, for the traditional funders, may I truly say you are doing a great job helping us in Africa to strengthen capacity. And I'm very happy here to see that UNESCO and Merck are coming together to further this so we can have more research, institutions, more scientists, and have more networking and people coming together to solve all the problems that we have in health. Research can do a lot in this, and we're counting on you all, the funders. So you're doing a great job, those that are there, and for those that are coming in, we welcome you. Thank you very much. I have 43 minutes.